Today I bring you an important message, one that can protect your health and maybe even save your life. On this channel, I always try to share practical knowledge that you can test at home, simple steps that give real results, not just quick tips or random tricks. And today's topic is one of the most critical for your heart and overall health. In recent weeks, I've seen and heard about a shocking number of heart attack cases, both in older adults and in young people. Sadly, many of them did not survive. Heart attacks are no longer just something that happens after age 60 or 70. They're becoming more sudden, more unpredictable, and more common even in younger generations. So what is really going on? Why are sudden heart attacks happening so frequently? The answer is not a mystery. It's not something we can't understand. If we open our eyes, the reason becomes very clear. Traditionally, men are at higher risk of heart attacks around the age of 65 and women around 72. But now, we are seeing younger people face this as well. The real culprit behind most of these attacks is not just cholesterol levels. It is the buildup of plaque inside the arteries. Think of it like this: just as dirt and sludge can clog up your sewage pipes, plaque can clog the blood vessels that supply oxygen and nutrients to your heart and brain. When plaque builds up, blood flow becomes restricted. And if that plaque ruptures, it causes clotting. A clot can completely block the blood supply in seconds. If this happens in the brain, it causes a stroke. If it happens in the heart, it causes a heart attack. This is the silent danger. It's happening inside our bodies without warning. But here's the good news: you can check the condition of your arteries at home with a very simple test. You only need a blood pressure monitor, something many households already have. And if you don't, you can buy one at an affordable price. This test is called the ankle brachal index, or ABI. Normally, doctors use expensive scans to check for blockages, but this method gives you a reliable idea of your risk at home. So let me explain how you can do it step by step. First, lie down on your bed and rest for 10 to 15 minutes. During this time, don't eat, don't drink, don't talk, just relax. Next, measure your blood pressure on both arms and note the readings. Then measure your blood pressure again, this time on both ankles, just above the foot and below the calf. Remember, in blood pressure, there are always two numbers: the top number, called systolic, and the bottom number, called diastolic. For this test, we only use the top number. Now here's what to do. Take the ankle reading and divide it by the arm reading. For example, if your ankle reading is 126 and your arm reading is 114, divide 126 by 114. That gives you about 110. Do the same calculation for the other side. Finally, take the average of the two results. This number is your ABI score. Now let's see what it means. If your score is between 1.0 and 1.4, congratulations, your arteries are healthy and free from dangerous blockages. If your score is between 0.9 and 1.0, it is still acceptable, but not ideal. You should still take care of your lifestyle. If your score is below 0.9, this is a warning sign. It means there is plaque buildup and narrowing of the arteries. The lower the number, the greater your risk of heart attack or stroke. For example, if your result is 0.8 or below, it means you are already in the danger zone. This is especially important for people with diabetes. Research shows that around 80% of diabetic patients eventually die from heart attacks, while most of the rest die from strokes or kidney problems. That is why every diabetic patient should perform this test regularly, just as they check their blood sugar or blood pressure. Sadly, most doctors only check cholesterol levels through a lipid profile and then prescribe medicine. But even with those medicines, the risk of heart attack and stroke remains. That is why this ankle brachal index test is one of the best tools you can use to know your real risk. So do this test at home. Write down your score. If your number is in the danger zone, don't panic. In my next video, I'll share exactly which foods and dietary changes can help lower your score, reduce plaque buildup, and even reverse the risk of heart disease and stroke. This video is a little technical, so I recommend you watch it again 2 or 3 times, take notes, and then perform the test. And once you do it, share your score in the comments. I would love to know your results. Remember, your health is your greatest wealth. Protect your arteries, protect your heart, and protect your life.